In this presentation, we will discuss different options for housing for older adults. We'll include a description of the different aspects that need to be considered when choosing between housing options, why it's important to choose the housing that is right for you, as well as go over some resources that might help decide which housing option meets the needs that you're looking for the best. Before we discuss the different housing options, I want to first discuss why housing options for older adults is even a concern in the first place. This chart by the United States Census Bureau shows that the number of people in general, but especially in older adults, is going to significantly increase by the year 2060. By 2030, 1 in 5 people in the United States will be 65 years or older. For the first time in United States history, older adults aged 65 years or older are projected to outnumber children by 2034. The more older adults there are, the greater the need is for more housing for them. Specifically, the greater the need is for affordable housing, as well as a variety of housing options to meet the diverse needs of current cohorts of older adults. Although we are discussing housing options in this video, we would be remiss if we did not note that the overwhelming majority of older adults want to age in place. According to the United States of Aging Survey, 9 in 10 older adults plan to continue living in their current home for the next 5 to 10 years. They noted they want to continue living in their home for the following reasons. 1, they like where they currently live. 2, they enjoy being near their family and friends. And 3, they really just don't want to deal with the hassle of moving. And then additionally, another important factor is that 1 in 5 believe they cannot afford to move.
There are many different factors to consider when deciding on the right housing for an older adult. Let's go over some of the most important ones. Overall well-being should be evaluated, meaning what would be best for this older adult's mental, physical, and emotional well-being. The next aspect to consider is the cost of the housing. Some housing for older adults can be very expensive, so it's important to set a budget when looking at different options. The capability of the older adult should also be evaluated, meaning how much help do they need? Are they capable of living completely on their own? Do they just need help with some daily tasks? Or do they need a lot of extra care and help daily? The last important factor is how long the older adult is going to be needing housing. Some older adults just need specific extra care housing after a surgery, while others are looking to relocate permanently. Independent living communities, which are also known as retirement communities. These communities are good for independent older adults who do not need help with daily tasks like getting dressed and bathing. There are usually meals available, and sometimes housekeeping, laundry, and transportation can also be available. These communities are good for those older adults who are fully capable but might be lonely and want to be in a more social environment. Assisted living residencies are similar to independent living communities, except they offer some personal care. This option is good for older adults who have some difficulties with daily tasks, but are still active and somewhat independent.
When people think of nursing homes, they generally associate them with negative perceptions of older adults and aging. Young and old people alike may regard them as a place where, quote-unquote, people go to die. Some of my students who have completed service learning opportunities in nursing homes often learn how misguided these perceptions are. After spending time with older adults living in these facilities and having the opportunity to participate in activities with them, they begin to see beyond their negative perceptions and learn what these facilities and the people living in them have to offer. Nursing facilities generally have a wealth of social interactions available, in addition to the medical assistance they are known for. Nursing facilities can provide medical assistance at all times of the day. Nurses and other healthcare professionals are there 24/7 to aid the residents. Nursing homes can be a great resource for those older adults that just had surgery and need extra help until they recover. Other residents might need to move there permanently. Many nursing homes also have a division specifically designed for those with Alzheimer's or dementia. This can be a good option for an older adult in the late stages of this disease. So what are older adults looking for when relocating? Researchers have found that older adults want to find a home that matches their needs. This includes finding the right size, the right design, the right location, and the appropriate amount of supports. In terms of location, how close is it to public transportation? Is it near their preferred stores, pharmacies, physicians, parks, libraries, and coffee shops? In terms of support, for example, does the housing option they're considering offer them medical assistance if needed? Does it offer meals if desired? Does it offer activities if they're looking for socialization opportunities? For some older adults looking at various housing options, amenities are important. For others, cost is a critical factor. Any older adult who is considering a move, perhaps because they want to downsize or because they need additional supports, they have to find an option that's going to work best for them. As we mentioned in the beginning of this video, most older adults want to age in place. To that end, home care services can be a great resource for older adults who do not wish to relocate. As we mentioned in the beginning of this video, most older adults want to age in place. To that end, home care services can be a great resource for older adults who do not wish to relocate. Home care services can provide many services including home-delivered meals, transportation, as well as household and personal care services. One of the main reasons that older adults decide to relocate is because many homes are not adapted for the needs of older adults. For older adults that do not wish to relocate, home adaptations can be made to their current home to allow them to live there longer. Please watch our Setting Up Homes for Older Adults with Limited Mobility video to learn more about options for home modification. The link to that video will be in this video description. An additional housing option for older adults is moving in with family or friends. This may be due to the need for assistance or simply due to the desire to spend more time with their family. For my own family, my in-laws moved in with us not because they needed our help, they moved in to offer us assistance with caring for their grandchildren. Thank you so much for watching our video to learn more about housing options for older adults. Please see the video description for references and a link to our video on setting up homes for older adults with limited mobility.